Hello and welcome to another week of Core Balance Coaching. And this week is actually a special week. It's going to be the last public stream that I do. So, meaning being on YouTube as a public live stream for anyone to join, students and non-students. I'm still going to be live streaming every week, but the streams are going to be specifically for core balance training students. And the reason is because we're growing, and it's been pretty difficult for me to keep up with the chat and to serve everyone. And so I want, the ultimate goal is to be able to help out core balance training students as much as possible. And so we're going to focus on them. And so I will be going live if you're a student every week in the Student Hub. We'll post this link in the Student Hub, answering all your questions to the best of my ability, and that will just allow me to, give better answers, because I felt like over the last few months, it's been, I'm trying to keep up with the chat, and in order to do that, I am trying to give quick answers, and I don't really like doing that. I prefer to give the best possible answer every time. And sometimes I felt like the students were getting the short end of the stick, and it just didn't feel very good for me. And so, we're always adapting, we're always growing and evolving, and this is what the next step calls for. So hopefully that makes sense. Hopefully you understand. And I will say that I probably will go live on YouTube to the public every once in a while. I'll continue to do that. It just won't be every single week. Maybe it'll be once a month. We'll see. I'm open to ideas, but we're still going to have a presence on YouTube. We're still going to be posting videos, and just the consistent, Without Pain Wednesday weekly live stream will be for the core balance training students. So with that said, today I wanted to go big for you all. I wanted to just answer every possible question that I can. And so there's no real topic. This is an open forum, open Q&A. And so I'm going to be looking into the chat and just answering questions. And I do have my own topic or question for myself that I will answer if it's a little bit quiet. It doesn't look like it's quiet already. It looks like the chat's going, but if I have some free time, I wanted to talk about just thoughts on why is it so hard to get out of back pain. What is it about back pain that makes it so hard? And in particular, it can be even more difficult for fit people or for athletic people. And so why is that as well? So maybe if that's a question that you're interested in, you can post in the chat and let me know that you want me to answer that. But that's the one I came prepared with as a topic if there were crickets in here. But like I said, it doesn't look like that already. And so I'm going to go up to the top. I see a question from Mr. Tran, who is in, I believe, Vietnam, and it's super early in the morning there. I don't know, like 2, 3 in the morning. And so I want to answer that one first. And then Ellen, I do see your question that I will be answering after that. I just want to get to Mr. Tran so that he can go to bed. And so the question is SI joint pain related to heel pain, or can it cause heel pain? And he says, I tend to limp after getting up, but walking something makes me feel better. Walking hard. I don't know what that means. Anyway, so yeah, there's definitely, in my opinion, a relationship between lower back pain, SI joint pain, and foot problems, foot pain. So heel pain is often related to plantar fasciitis, which is just it's a localized muscle imbalance in the foot. And it can be caused from something as simple as lack of ankle mobility. If your ankle does not flex up or dorsiflex as much as it should, then every time you push off the ground, that movement is going somewhere else. It doesn't go into your ankle like it should because the ankle's tight. It then goes most likely into the arch or the fascia in the bottom of your foot. And doing that 10,000 times a day, or not even that much, causes inflammation and stress and repetitive trauma to the tissues on the bottom of the foot, because it's excessive movement, excessive stretching of that fascia. And so that can cause pain, and that attaches right into the heel. And so that often is where people will feel plantar fasciitis first, and it can extend farther into the foot. So it's a muscle imbalance. SI joint pain is often related to a more centralized imbalance between the glutes and the abdominals and the hip flexors. Usually tight hip flexors are one of the culprits in SI joint pain. And so, there's a direct link between the foot and the pelvis, and that's called the leg. It is very direct in my opinion. So those imbalances can influence each other. They can be related. And the one thing I want to say, having had personal experience with this, SI joint pain and foot pain, Mr. Tran, is that actually the limping, it can be chicken or the egg. The limping can worsen the SI joint pain. So the limping from the foot pain can actually cause or exacerbate SI joint pain, and vice versa. The limping from the SI joint pain, because if you have severe SI problems, you're going to be limping. That can cause, basically favoring of one leg or the other, and that's what limping is. And so that repetitive, the excessive favoring or weight or impact on one side, that can actually cause extra stress to the foot and lead to something like heel pain. So my best advice in the short term, like that I can give right now, besides bringing your body back into balance, which is a whole thing. It doesn't just happen in doing an exercise or even in like doing a week of exercises. It happens over months and changing lifestyle. That's the best thing you can do. But short-term advice is anytime you have a problem with one leg or one foot and the tendency is to limp, that's going to likely cause other problems in the body. It could be the hip, it could be the knee, it could be the shoulder, it could be, it goes up the chain. So limping is not good for the body. And so my advice is to try and reduce the amount of limping that you do to the best possible degree that you can. So how do you limit limping? Well, you be really conscious of the way that you're walking. Try to walk symmetrically. So this applies to you anybody else that's here or watching. If you have knee pain, if you have whatever, you name it, and it's on one side and it makes you want to limp. You might have been limping for 10 years and you might not even be aware of it. Somebody might tell you that you have a limp and I didn't even realize that. And that happens all the time, right? So become aware of your body, and while you're walking, try to walk as symmetrically as possible. And if it's too painful to do that, and that's why you're limping, because of pain, then you might need an assistive device, a crutch, a cane, support, arch support in your foot. I talk a lot about going barefoot, and that is, my belief, is the best thing that you can do. But sometimes you need a crutch in your foot. You need an arch support because of whatever's going on. And so temporarily, those things can be really helpful. But ultimately, you don't want to become dependent on them and use them for the rest of your life. You want to wean off of them after you're done getting the benefits from them. So that's the long answer for you, Mr. Tran. Hopefully that helps. And we're going to answer Ellen's question. So hello, Ellen, and good to see you here live, as I've seen you many times before. And your question is, any tips or tricks for addressing tight paraspinal muscles? So this is a really common thing. This is part of the monster that we're trying to address in core balance training, and Vladimir Yanda's cross posture syndrome. The lower back muscles, the paraspinal muscles, are tight. They have the tendency to become overly tight, and just like the hip flexors, they're in that same group. And so how do we address that? So that's a big long answer. And you also say it seems to be negatively impacting SI joint stability, and that is likely. It's connected directly to your pelvis. I personally think that the hip flexors have a bigger influence on the SI joint than the paraspinals, because they're actually, the direction of pull on the pelvis is more forward. If you look at my skeleton right back here, the hip flexors would be pulling the pelvis, the top of the pelvis right there, this direction forward. And so that is the torque on the SI joint is, because of the angle, is much stronger than the paraspinals, which would be pulling in that direction, upward. And that also does have an effect. It's just a little bit less torque. So be aware that it could also be your hip flexors, Ellen. And so that, begs the question, what do you do about that? And it's really, you got to ask the question, why are they tightening up? So the reason why muscles tighten up can be one of two major causes. One, they're protecting something that is injured. The body has this protective mechanism where it tightens up certain muscles to bring you into the protective position, which is the fetal position. So they could be protecting the injury, and so you kind of got to override that with providing support around those muscles, around that joint, so that those muscles can feel safe to let go. And the other reason number two, major category why muscles tighten up, is because they don't feel safe functioning. The muscle itself doesn't feel safe functioning in that length of range. So it might be weakness. Most often is going to be weakness or a lack of endurance. So a muscle that it doesn't have control in, say a muscle is being stretched and it doesn't have control in that new lengthened range. And we experience this all the time. Go ahead and stretch your hamstrings and loosen those babies up, right? Well, guess what? A few hours later, they will have tightened back up to their normal length. And the reason is because they probably don't feel safe in that lengthened position. They haven't been trained to function neuromuscular control in that lengthened position, so they don't allow themselves to go there. And so they will tighten back up and say, this is where I feel safe to be. I don't want to get a tear. I don't want to get a strain. And if I allow myself to be lengthened like that, I'm vulnerable. I'm at risk for those things. So it's really important when you stretch a muscle, say it's your paraspinals, to then either do an active stretch like yoga, or so where you're using the muscle in the stretch, or to follow the stretch up with some type of movement retraining that trains the neuromuscular system to operate with control in that new lengthened state. And so that's the long answer, but so the two strategies for the two different types of reasons why muscles tighten up is one, provide support for those muscles with the other muscles around it, right? The paraspinals are not alone in supporting the spine, so you have the muscles on the sides and on the front. So build up not only their strength but their endurance by using them and incorporating them more into everything you do. So that would be abdominals, glutes, and all the little tiny muscles underneath, even the deep hip rotators, which we don't talk a lot about, but there's a whole bunch of tiny little muscles in the hip. So hip mobility, hip rotation is really important for loosening up the lower back, because the more the hips can do, the more that the less the lower back has to do. And so if the lower back has kind of the load taken off of it, then it gets less fatigue, less repetitive trauma, less just aggravation. And so that can just lower inflammation and allow the muscles that are protecting or operating the lower back to take a breath, right? So providing support is number one. And number two is if you're going to stretch the paraspinals, to actually follow it up or train them how to function in that lengthened state. And so that one's a little more, I don't know, I want to call it a little more, you might want to kind of professional guidance with that, unless you're super in tune with your body, because what you're essentially doing is you're operating your body at the edges of its safe zone where it wants to be. And so you got to be really in tune with your body for that. And in order to push the edge out of function, you have to work right at that edge. Hopefully that makes sense. I know it's not like a direct answer, like, what do you do? I'll go home and do this right now and you'll be good. Those types of answers are the ones I would love to give, but just not really as common with chronic problems. So I see NPE showing up. Hello, Vicus Pilly. Hi, how you doing? I see a whole lot of stuff popped in the chat, so we're going to try and move on this guy and see if I can catch up. This is the same thing that this is the reason why I have to make the change, is because right now, even just looking at this chat, I'm like, wow, how am I gonna catch up? And then all of a sudden I have to help out the actual students in the program that we usually bring prepared questions for. So next question is, so Vicus just sharing upper lumbar lower thoracic disc, so like L1, T12, L1 maybe. Yep, so that's right there in the sweet spot where we are, the back anchor zone in the program, Vicus. So if that's a really important area, a support zone of the spine. It's the bottom of the rib cage in the back. So hopefully you get some benefit from the program. I know you just joined. Joseph Sanchez, hello. Module 6, okay, trying the single leg bridge. Next day you felt sciatica. Any tips, or should I tone it down? So this is good information for you about your body, like where is your limit, where is your edge, and so it seems like the full single leg bridge is beyond your tolerance right now. And what you were doing before that might have been below your tolerance, because you felt the courage to do a more advanced exercise like a single leg bridge. So you want to work between those two areas. So take advantage. I know it was a setback, but setbacks are a great opportunity to gain wisdom of your body, where its current state is, and then continue to make progress. So work between that difficulty level, and one way to do that with a single leg bridge is arm support. So there's a video in the extra lessons of the program, like it's one of the early modules, where we call it extra concepts or lessons library, where I teach all the different arm positions of the bridge. So like this, like this, like this, or I don't think there's an overhead one, but do one of the more supportive arm positions with single leg bridge. I do that when I'm feeling kind of weak or not in shape. I will use my arms kind of heavily with single leg bridge, because it provides excellent support. So I would consider that. But another regression of the single leg bridge is just bridge into marching. So we do a marching in phase 1 in module 1, where it's day 3, it's the back anchor progression. But that one's kind of with your back anchor on the ground. You can do that same kind of marching up in the bridge. So your legs aren't straight, but they're bent, and you're just marching, like this, lifting your knees up, arm support. And yeah, so it is an advanced exercise. It has a lot of torque on the pelvis, SI joint, area, and it definitely has the ability to cause a flare-up if you don't have the muscular support to stabilize your pelvis and your lumbar spine while removing one of your legs in the bridge, right? A major support. So you have to replace that with core control. So great question. Hello, Kara. Pamela Olson, first live. All right. So you're already in module three and you made it live. So great to see you here, Pamela. And we'll be doing the live streams in the Student Hub moving forward. So it won't be your last, hopefully. Let's see. Court. When you're in module 2, are you supposed to think of the top front anchor as incorporating the bottom of the sternum? I don't normally think of the sternum because it's kind of like, it kind of caves in the middle here. So the contact points are more on the side. But if your sternum is everted, which it is in some people, you may feel more pressure in the middle. And so, yeah, you can think of that as the upper front anchor. It is the lower part of the rib cage, which includes the sternum, in the front. And you're kind of pushing away from that. So that's a really good question. And I have heard somebody else ask about the sternum before. So just think of the upper front anchor as more of a zone, not so much like one point on the rib cage, like right there. It's more of a zone that you're able to push away from, just as if baby or an infant was doing that. It's, they're not pushing away from anything in particular. That's their connection with the floor. All right, so we've got NPE. I introduced CBT to my chiropractor. Get ready. I think you have created a revolution in the practice PT. Oh man, I hope so. I'm ready. I'm trying to put a dent in the epidemic of back pain. It's everywhere. I was on a podcast yesterday, and the interviewer, the podcast host, has back pain, and was just basically the whole podcast was her asking me how to get out of back pain for herself. And I was like, yeah, this is great, because a lot of people listening want to ask the same questions. And it's like almost every podcast interview I've had has been like that, where the interviewer is like, yeah, I've got back pain, or I've had back pain. Like, it's just that common. So let's go, Angela. First Pilates class. All right, connect to your anchors. That's gonna be the big one, and prioritize that, Angela, over whatever the instructor's telling you to do. My best advice is to prioritize the anchor connection, and then secondary add in what they're telling you, and you can do it, modify it. Yeah, respect to the people that modify yoga and Pilates and all those other types of classes, because it takes courage, and it's prioritizing your health, over trying to be like the class, right? So good luck to you, Angela. And all right, Marina, thank you for the advice. Yeah, public Q&A once every month or two. NM, pain in the back whenever I sit to study. Yeah, that makes a lot of sense. Burning and up to the neck and head. So not really a question, but sitting, there you go, right? So break it up, get up and go for walks. And if you're in the program, push away. Sitting and breathing can be really helpful for just extending the tolerance and your comfort while sitting. But it doesn't mean you should sit longer or sit more. It'd still be great to get up and go for walks, walk around the block every 30 minutes. It improves your enjoyment, your ability to be comfortable with sitting. So, Don, why is it so hard to get rid of back pain? Yeah. So, if I can catch up in the chat, that's what I'm going to answer, because that's the question that I have. And, I'll just, kind of flow on that one, but I don't know if I'm going to catch up in the chat, and it might have to be a future topic, which I would look forward to. So Abby, hi and thanks. Is it okay to ride stationary bike, easy zone 2 if I have SI issue? It's okay, but it's not optimal. It's not going to be the ideal exercise. I would much rather have my students be walking or going paddleboarding. Stand-up paddleboarding is an incredible exercise, full body. Just anything that's going to be sitting and exercising in the sitting position is just not, it's not really ideal. It's not something that we, if you believe in evolution, it's not really something that we evolved doing. And our bodies are much happier being in the, human locomotion position, which is walking, standing, reaching, turning, variety, stuff like that. And so there's a couple things that I don't love about the bike. The other one is that it's just not a lot of variety in the movement. Hopefully that helps. Sorry. Stand-up paddleboarding if you like to do, non-walking activities is another example of one that I don't love is kayaking. Just sitting and then training your body in that position is just not ideal. Okay, Coral, module 2, front anchors. Progression causes you discomfort. That's not uncommon if you're going hard with it, but if you really turn it down, I see you mentioned the 10% rule. You're feeling pain in the right glute, lower back, and right side, so it's all right-sided. It's possible that you're breaking the 10% rule. My recommendation to you, Coral, is to follow the 1% rule, 1 or 2%. Okay, so if you can turn down your intensity that low, then you won't be breaking the 10% rule, and you may have a breakthrough, because it's really a meditation on the body. This is much more of a mental exercise and connecting mentally with your anchors. And then if you can even just push away to the point where nothing actually moves, but you increase the pressure into the floor and activate those muscles, the muscles will still activate, so you will still get the same benefit from a neurological perspective as if the legs came off the floor, because the muscles are still activating, and that's all we want to do is send electrical current through those nerves and say, hey, I want to use you. I'm still using you. Don't go to sleep. Don't disappear. Don't atrophy. You're going to get all the same benefit without the downside of potential flare up of, that it's a vulnerable position, causing the back muscles to contract and backward bend the spine. Those are the things that can cause pain. So you can get the benefit without those costs. All right. Coral, I just did that one. Karen Yeager, on my back doing the get fat successfully. All right, trying bridge, but I lose the get fat as soon as my back starts to lift. Also, I'm pushing into my feet a little. Is that wrong? No, it's not wrong. It's normal. And you got to use your feet for the bridge. So you got to use your glutes and your legs and your feet for the bridge. And it's really important that we just initiate the bridge with your abdominals and we keep them active. And so that's staying fat. And that's a really hard thing to do. And that's why it's a lesson in the program. It's an entire day. We spend the whole week really learning how to do the bridge, because it ain't easy. And it takes repetition, and it might take you a couple weeks to be able to do that, Karen, and that's okay, and that's normal. And we're training movement patterns in the body, and the hardest part, and this ties into why it's so hard to get out of back pain, is we have to break out of deeply ingrained patterns that may have been going on for 10, 20, 30 years in order to do that, and to override those default patterns with new patterns, and it takes a lot of focus. So be patient with yourself, and you're not doing it wrong. You're doing it right. The fact that you're aware that you're losing the get fat, that's the right way to do it, the awareness. Okay, So Ashley B, any tips for overcoming antalgic lateral lean from herniated L5-S1? Sciatic pain for 7 months with lean to the side of pain. So I have a little bit of a different take on this. Some PTs will say go up to a wall, and I can even show you what some PTs will say. So they'll say go up to a wall, and if you're leaning one way, then shift your hips into the wall and try to push that thing back the way that it's supposed to be. But my take on this is a little bit different. I think the body makes you go into that position for a reason. I don't think it's there's no reason why that you're leaning that way. I think the body is protecting something. It could be, let me read again. So herniated disc. So it might be protecting a nerve from getting compressed or impinged by disc material. It may be any possible reason why the body's saying right now you need to be a little bit like this because of fill in the blank. And so I'm not going to try and override that and say, oh, I'm going to push your pelvis back into straight. I think that the best thing to do is actually approach it from almost the opposite perspective and say, all right, let's try and create some function in the muscles that are actually not tight. Okay, so all these muscles on one side have tightened up to protect, and so the tendency is, oh, why don't we stretch those muscles because they're tight, and so that will even us out. But what about the other muscles that may have been shut off for how long? 7 months? What about actually waking those up and focusing our energy on those muscles? And if those muscles can start doing their job, then maybe these tight muscles will be able to let go. And often that's what I find. I often find that the best way to address tight muscles is not by just stretching them, but by providing them with support from the muscles around them, and then they kind of just let go on their own. They stop protecting. So that's like the big picture way I look at it. If we're try and zoom in, you've got antalgic, which just means a limp. We talked about limping in the beginning of the stream. I don't know, Ashley, if you were here, but I talked about that. You might want to rewind to the very first question in the stream where I talk about limping. And so there are strategies for sciatica. I have a whole video on it, but if you have tried McKenzie method for repetitive extension or repetitive flexion, and if you haven't tried that, it's worth giving a try, but it's not guaranteed. If you have tried it and it didn't work, then forget about it. It could make symptoms worse, so be prepared for that. And other than that, then if you're in the program, my recommendation is go through the program trying to be as symmetrical as possible, because that is going to require the muscles on the opposite side to function. In order to be symmetrical, you have to have symmetrical involvement or participation in the muscles in all the sides of your body, right? And so trying to be symmetrical, and then when you get to the part of the program where we are doing unilateral stuff or one-sided stuff, spend more time on the weak side. Okay, so forget about stretching the muscles that are pulling you over. They're doing that because your body has decided that that's the best way to protect you right now in your life because of the stuff going on in there. So if we can support those muscles by spending more time on the opposite side, those muscles might not have to hold on so tight because they feel like they have more of an army of muscle groups around your torso to provide support for your spine. And so that leads me into the breathing and the decompression type stuff that we do in the program can actually be extremely valuable for sciatica type stuff, decompressing the spine. All right, let's keep going. NM, why burning in back and then neck and then head? Why? So the burning is going to be nerve pain, neurological symptoms. And if it's going up through into the head, then it's most likely the source is from the neck, because nerve flow doesn't usually go uh, up from the nerve. Like if you have a pinched nerve in your lower back, you're going to feel the symptoms below that. Okay, you're not going to feel symptoms from your lower back nerves, the ones that exit the lower back. You're not going to feel symptoms in your hands or your shoulders or your neck from that. The anatomy that's up higher is innervated by nerves that come out of the neck, and so I would imagine that might be a source for you, and that makes a lot of sense for studying because you have your head down. If you're sitting a lot and looking at a screen, then your head might be cocked back to look at your screen, and it's just a really not ideal position. So my advice, NM, is to listen to that, pay attention to the things that are causing that, do less of those things or break those things up, and pay attention to the things that make you feel better, like probably walking, and do more of that and break up the bad things with the good things. And if you just follow that strategy, you are going to inevitably experience improvement over time. Not in a minute, but in a week or a month or longer. So you got to stick with it. Mike Minto, I'm loving the program 3 weeks in. My question is, do you have any suggestions for stabilizing core during golf swings? I think that's going to be an entire stream, golf. I've talked about it a lot in the past. There has been confusion in the past about like anterior pelvic tilt during a golf swing. I don't recommend that. I recommend pubic bone forward during the golf swing. I recommend treating the swing as if it originates in your core. So if you're in module 3, you know, or I don't know if you're in module 3, but if you've gone through module 1 and 2, you know what the anchors are. You want to connect to those, even if it's just the back anchor or the front anchors, or, you know, we don't put all of them together until module 5, I think. But don't rush to get there. It takes a while to build up the anchors. Anyway, just remember them during the swing. Imagine that your core is the source of your swing, so the power originates in the core, and I would call it a core golf swing. So I do this with certain things like riding a bike or paddling on a surfboard. I call it core paddling. So my arms are not the source of my power. Actually, my core is. And so it just shifts something in my mind, which shifts something in my body, and I can feel my core working when I'm doing this. When beforehand, it would just be my arms and building my shoulders and my back, and my core could essentially be completely turned off. And so this has really shifted a lot of the things that I do, and you can apply it to anything, but especially a golf swing. If you just really imagine that everything is coming from the center, that is the brain of your movement, and it's the driver of the power. That is a great way to stay connected. And pubic bone forward, not anterior pelvic tilt. Okay. And then hip rotation is going to be massive, but that comes later. You have to have core stability before we start training hip mobility, and that comes later in the program. So you'll really benefit from some module 10, I believe, module 10, module 9, 10, 11 type stuff, phase 3, essentially. Okay, Sherry, so happy growing. Thank you, Sherry. Oh my gosh, Sherry, I gotta say, my favorite live stream attendee over I don't know, I've been doing this every week since like April of 2022, maybe March or April of 2022. I've been going live every week, and I haven't missed a week except for the week that my son was born. Some weeks I had to pre-record the live stream, but I have not. I only missed that 1 week. So, and Sherry has been showing up for more than anybody else. So I want to express my gratitude to Sherry. Thank you so much for being here for you and for me, and the support that you've always shown us. We, as a core balance training team, the whole team, I don't know, there's probably 9 or 10 of us now. We love you and we are grateful to you. So thank you. And you say, applaud your decision to focus on core balance students, but agree with Marina, an open live stream once every other month would be nice. So second recommendation. So I think that's a good idea. Always taking advice from the people that we're serving. And I think that might be what has to happen. Maybe like once a month, maybe every 2 months at the least. But we got to keep this going for the non-students. I agree. Cesar, after about 2 months of CBT, my lower back pain and discomfort finally subsided. I went back to enjoying sports that involved sprinting, and my back pain came back, and I've regressed most of my progress. So that's okay, Cesar. Thank you for sharing. Listen to your body. Go back. Do the things that helped you get out of pain. And then when you reapproach sprinting, because you should get back to sprinting. It's not that you can never sprint again. It's that you have to take a different approach. Use that wisdom that you've gained from this experience that you had and do it a little differently. Do it with more focus, more core connection, more subtle progressions. Don't just jump straight into it, but you're going to take smaller steps towards sprinting from jogging or running. So Pamela, I coughed really bad at 14 months ago and threw lower back out. I've had horrible lower back pain, probably 80% better. Still have problems with pain on the right side where ascending colon and appendix is. Okay, no question there, but I think you were one of the previous posts. And so yeah, a little history. Everybody's got their unique story, and this isn't definitely a unique one, but 80% is huge. So do the things that got you to 80%. Do more of that. Double down, triple down on those things, and less of the things that have been holding you back or causing you pain. Sherry, question, why is back pain so hard to get rid of? Yeah, I think because of the amount of comments, Sherry, that is going to have to be a future topic, which I look forward to. Hello, Asti. Thank you. Yeah, thank you. I understand that fear-based movements makes the pain cycle worse, but knowing that most of my flare-ups and original injury were my own doing, do you have any tips to get over the fear of your own self? Yeah. So before Breann Marie, before you decide to do something, say it's a movement or an activity that you find scary, if you know that you're going to do, if you do that activity, it's going to be fear-based, I would say don't do it. Just rather than do something in fear, don't do it at all. But if you can decide before doing that activity, okay, I'm going to do this. I'm going to do it confidently. I have confidence in my body. I know I can do this, and my back is strong. I am strong, and I'm not going to hurt myself. I'm going to do this successfully. If you can get into that mindset, that's when you do the activity. But if you can't, and you're like, I know that I'm going to be in fear, I would just say, don't do it, or do a modified version of it. It's not always just lights on, lights off. You can dim the lights and do anything. I can think of very few things in life that you can't do on a scale of intensity. Turn it down, do it at a real low intensity, do it in slow motion, do it under control, make it fun. Do it. I have a friend who's a physical therapist, and we'll do the weirdest stuff, and we'll just turn walking on rocks into, slow motion movements that require incredible body control. And when doing things in slow motion is a great way to get maximum benefit, because control requires strength, endurance, motor control, but doing them in slow motion also minimizes the risk of injury and impact and mistakes and slipping and all that stuff. So yeah, that's one thing you can do is slow it down a lot. Make it fun. And then if you can do something successfully, what you are naturally doing without even trying is you're building up your confidence. And if you can stack those experiences of successful accomplishments, then your confidence will build and build and build, and then ultimately you can have a healthy level of fear. It's not no fear, right? It's a healthy level, and most of the things that you do in life can be done with a lot more confidence, and enjoyment is really what it comes down to. Ellen, that makes sense about hip flexors, paraspinals. I've learned through your program that this is a lifetime journey. Yep, it never stops. So anyone who's here who's going, yeah, how long does it take to get out of pain? How long does it take to be normal again? It takes the rest of your life, because you're not going to get to a point where you can just stop thinking about moving healthy or being healthy or the health of your back or your spine. I haven't stopped, and I've gotten out of pain, and I want to continue to get better. I want to continue to improve myself beyond where I'm at now. And if you can maintain that mindset, I think that's a really, I think it's a really great way to go through life. Just always trying to improve. So if you can, yeah, Ellen, I completely agree. Lifetime journey. It never stops. And try to enjoy the journey. That's where you really win, is if you can enjoy the struggle, enjoy the progress, enjoy the little mini victories, enjoy the milestones. That, I think that's really where you actually win, is because if you're not enjoying it, I think of like people that, there's people that eat really healthy and they do it well and they enjoy the food, and there's people that eat really healthy that don't really enjoy it, and they're doing the same thing, just the mental health is a lot different. So you want to do the thing and enjoy it at the same time, even if it's not considered like a fun activity. Mary Rubens, my first live, yay, third week in the program. All right, you're the second person to say that. Third week, first live. It's important to have a diagnosis. No, it's not. Hey, I love that question. I've never been asked that question, and I really love it. So no, it's not important to have a diagnosis. It's way more important to listen to your body. Your body will tell you the things that it likes and the things that it doesn't like. It will tell you that it doesn't like backward bending if you do it, and it causes you pain. That's the communication, right? Well, it does the same thing with good stuff too. So if you do something that your body likes, then it will give you good feelings. You will feel good after doing that. And then if you use those parameters as your guide, it's called listening to your body. That is way, way, way infinitely more valuable than a diagnosis. And you can ask all the people that have had diagnoses out there with back pain or you name it, and ask them if that diagnosis made them better, or if they were able to reach a goal because of the diagnosis. Ask that question, and my personal opinion is no. It's actually the listening to your body that is what sticks with you and can actually help give you wisdom and continue to build wisdom about yourself and your body that will stick with you for life. That's a much healthier thing than having a diagnosis that also sticks with you for life. Where are we? I got lost. I just feel like I'm kind of maintaining the level where I'm at in the chat. I lost where I'm at though. So, sorry guys. Okay, I think I just found. Oh, okay, Mary. I'm not sure that I have SI injury pain. I don't have the popping. I often see mentioned here. Thanks. Okay, yep. Nope. It's if you don't have the popping, then that's a good thing. But there's also a thing to be said about the pain. So the location of SI pain is very specific. It's right on the back of your pelvis at the PSIS, and I point that out in the SI joint video. Jaimela Dulaney. Thank you, Anchor Awareness, allowed me to successfully complete a 50-mile trail run. That is awesome. Jaimela, if you're still here, thank you for sharing that. Congratulations. That's huge. And just curious, what were you wearing on your feet for that trail run? Just curious. I have a friend that did that recently in Luna sandals, which I was very impressed with. So yeah, trail running is the ultimate because of the variety that you get from the changes in the ground. Yeah. Melissa Ruff just joined the program. Will it help with degenerative arthritis in my facet joints? It will help stop the progression of the degenerative arthritis. Degeneration is what it is. It's something that is often more permanent in nature. But if you can stop the progression, it will allow the body to heal what is left of basically the cartilage in the joints, and to the best that it can. And yeah, and that is what can help the pain go away. So the pain can be from continued damage. But if we can stop the damage, the body can go, all right, we'll reach homeostasis. We are here, and this feels pretty good. We're not getting worse, and so I'm not going to send you pain signals anymore. And that's really, I think, what you're concerned with, right? Otherwise, you wouldn't even know that you had arthritis if you didn't have the pain. So you're welcome, Joseph. Breann Marie. Also in week 3, loving every second. Great to hear. Oh yeah, okay, so you're feeling tension because you're being robotic. So instead of being robotic, Breann, be like a jellyfish, but have that movement come from your core, and so that can help loosen you up. Or listen to some music that gets you moving and loosen you up, because yeah, that kind of robotic tension is it is what it is. It's tension, and tension is held in your muscles, and we want to move. We want to flow rather than move like a robot. All right, where are we at? Hector, I have a broad-based disc herniated L4-5. I'm able to get my cardio in doing a stationary bike. Oh, second question like this in the chat today. Yeah, you are able to, but it's not ideal. It's not what I recommend. If you want to get cardio, and so walking is not enough to get your cardio, because I strongly recommend walking over a stationary bike. Try walking up a steep hill if you have that available to you. That'll get you cardio. Or hiking, or stand-up paddleboarding. Something that's not exercising in the sitting position is what I recommend. Beverly Amsler, maybe you could speak to how much back pain affects your emotional well-being as well as physical. I was thinking about that this morning as a topic for today, but I'm not going to have the ability to, because it's so big, Beverly. It's a fantastic question. It's so big of a question that I have to do an entire stream on it. So we're going to mark that down. I'm going to have our team put that on the list, and that's going to be a future topic because it's so important. So thank you, Beverly. Brian Bond, can you explain why my back hurts the worst after sleeping? And is there anything you can recommend to help with that? Another common question, Brian. So could be your mattress, right? So if you your mattress is too soft, that can cause sagging, which the muscles will like tension up to try and prevent your spine from sagging for 8 hours. If it's not your mattress, my theory about that is that So the body actually, sleeping is an opportunity for the body to heal some things. And so some of the ways in which we heal things is the muscles will uh, tighten up to kind of put a splint around the area and protect it, and then send all the healing, energy into that area of the body. And when that's happening, the body does not want it to be moved and get injured more. So it will say, okay, I'm going to make it be painful if you do that, because I'm trying to tell you that you shouldn't be doing this to me. You shouldn't be moving me. You shouldn't be causing me more damage, because I saw this opportunity while you were not moving for 8 hours and you're sleeping to heal you. So I'm going to try and take it. And that might be happening on a recurring basis every night, where the body goes into healing mode, and then you wake up and it's like, wait, no, give me some more time. I'm trying to heal this. And then, you got to go to work and say you feel the pain. Then you go through your day, loosen up a little bit, that muscle stiffness type pain. So it's like ischemic. It's called ischemic pain. And it's where there's not a lot of oxygen in the tissues because the muscles are stiff. That kind of gradually goes away as you move through your day, because blood starts flowing when you move. So the pain goes down, but actually what doesn't make sense or register often is that when you're moving is when you could be causing the damage. And then the cycle continues that night. Okay, little damage. If you have muscle imbalances, or your joints are not perfectly congruent, they're a little off. So that movement, that friction with the incongruent joint, a little bit of damage, go to bed, and then that healing cycle continues. So another example of how that happens is this is so prevalent in so many injuries, but we'll just use the knee or the back, whatever, fill in the blank. You got to run away from a danger, and you're hurting your back or your knee while doing it, or you have an impact that causes you an injury to your body. Well, the body, in order to be smart and rescue you from the danger, whether it was a bear or whatever, you name it, doesn't say, oh, here's a ton of pain right now, stop moving and just lay down, because the bear's going to catch you. So it allows you to get away and be safe in a safe place. And then it will say, all right, you're here, you're resting, you're relaxed. Here you go. Here's all your pain and stiffness and tightness from what happened while you were running away. Now we're going to heal you, now that you're not going to die if I stop you from moving now. So that's why oftentimes is extremely common. We don't feel it when we're hurting ourselves. Yoga class, whatever. And then later in the day, we get home, we're on the couch, and it's like, oh, tightening up. Well, that's the body taking the opportunity to go, okay, it's time to heal now. So hopefully that makes sense for you. And that was from Breann. Anything to recommend with that? Yeah, so the best thing you can do is stop hurting yourself during the day, and that is the hard thing to do, because you gotta move through your day in a healthier way. If you have to sit a lot, that's not very good. So we gotta restore muscular balance in the body. We have to bring our joints back into alignment. We have to apply healthy movement to everything we do, not just the 1 hour that you go to the gym, but the way that you are doing the dishes, the way that you sit, and so that's what we teach in the program. I don't know if you're a student or not. I can't remember if you mentioned that, but that's the goal of the program, and that takes months to do. Yeah, it's not easy, and it's still what I'm trying to do with myself. All right, Mr. Tran, still here. All right. I wonder what time it is there. I'm trying to, there we go. Nope, that's not working. There we go. All right, Mr. Tran, I just finished module 4, practice single leg bridge. It's difficult but in a good way. As my core glutes work hard, I imagine it'll be harder with the band. Band will make single leg bridge a little bit easier, actually, surprisingly. So a little bit of just another piece of support. So yeah, try that as a. I forgot to mention that to the other person. That's another way to regress the bridge, is to add the band. All right. Miss McCreary, I'm getting in shape for a double lung transplant. Will your core training help me get stronger to handle it better? Yeah, I mean, the core balance training is beneficial to really anyone because it's just full body posture, core connection, and most people require a strong motivation to commit to something like this, and so pain is the best motivation, right? So back pain, and that's who the program helps the most. But ideally, people would do this in a preventative way. So I think that's a fantastic thought, Don, to do this in a way that would prepare you for a serious surgery like that. That is that's huge. Yeah, and I wish you the best of luck and prayers to you for your surgery. And I would encourage you to do core balance training just to help prepare your body for something like that. The lungs are definitely impacted by posture, and this is a program that opens up the rib cage and opens up your that curled forward posture, and that can help with the function of the lungs. Yeah, so I do believe that. Mr. Tran, one thing is my knee pops crack when I move the knees and up and start and straighten them. No history of knee pain, but just curious if it means anything. If it's not painful, then don't worry about it. It's not a problem. It could just be release of gas in your joints. So don't worry about it, Mr. Tran. And if it becomes painful, then we can have a conversation. When can I get into the coaching class? Good question. It's still full. So I'll have to take a look at the list. I would say that potentially in the next month, I will have at least 1 or 2 openings, because there's been some people in there for a while and they're getting close to being done. And so that's kind of the timeline. But now that I'm going to be having a less workload on this kind of thing, answering 100 questions in a row on YouTube, I might be able to expand the coaching hub a little bit. So thank you for that just question, Pamela, because it gets me thinking. Julie, will your core balance training work if I have mild cerebral palsy? Yeah, it's not exclusive to any one type of person. It can be beneficial for someone with moderate cerebral palsy. If it was severe, I don't know if that would be possible, but it seems like, to me, someone with cerebral palsy could have enough trunk control to connect to the anchors, connect to the core, and I believe core connection is really helpful for anyone. Yep. Hector, is MRI worth getting a second opinion on from the radiologist? Seems they all have different wording or interpretation. Thank you for the kind words, Hector. I have mixed opinions on the MRI. I think the MRI is most useful for ruling out cancer, tumors, like uncommon causes of pain, but typically it's not really going to help. It's not really going to help like teach you how to listen to your body or help you to develop a better relationship with your core and the way that you move and your posture. I don't think MRIs really help with that. So if you can use an MRI to rule out really serious nerve impingements that might be, could lead to something like paralysis or cancer or, I can't think of anything else right now, but stuff like that, then that's for me kind of where it stops. And then I'm going to put my energy into, you know, listening to your body is such a huge topic, and I've done multiple streams on that topic. The most valuable skill for getting out of back pain is one stream that is all about listening to your body and what does that actually mean? What is the skill of doing that? I think that's a lot more valuable. So yeah, those are my thoughts on that. Indy Curry, today is the last day of my free trial. I will definitely be continuing as a CPT student. That's great to hear. Indy, my core is already waking up. My doctor is recommending facet joint nerve ablation, but I'm wondering if I should wait. If you are wondering that, then I think that is your answer. I think you should probably wait if you're already experiencing improvement. Let's see how far you can go. And something like that is really, it feels kind of final to me. You're going to perform ablation of a nerve. There's no undoing that. And so let's just make sure there's no harm in waiting if you're experiencing improvement. Let's see how far we can go. Yeah, great question. Mary Rubens, all right, you're welcome. Pamela, I was asking, let's see, I'm going to check how many more questions I have. I'm just going to keep going. I've been going for over an hour already. This is all just chat today. So here we go. And we still got 69 people here. I was asking, why do I have the right side pain in the front where the ascending colon appendix is along with the lower back? Okay. I was at 80% better when I started your class, and it is improving. Thank you. There could be multiple factors. One factor could be, I'm aware of this recently because my wife just gave birth, but there can, if you've ever had children, there can be leftover kind of scars or extra tissue built up in there that could be pressing on the ascending colon or the appendix. So there could be many numbers of factors. It's not something that I commonly hear or see in the program, and so it could be too many numbers of things that I can't really, I would be just widely speculating, because there's a lot going on down there. This is the bowels, and you could have an obstruction. You could have, the appendix itself is a common source of pain. So I would need to know more, and it still wouldn't be enough. I don't have enough knowledge of that kind of medicine to be able to give you an answer that I feel confident giving online like this. So it's a good question, Pamela, but it's just not something I see too often. And I'm glad to hear that you're getting better. Yeah. So Lynn, loving the program. You're very welcome. I've used a 10-pound kettlebell at times to help anchor my lower rib cage to the floor during back anchor activities. Okay. Do you see any issues with that? Are you putting the kettlebell, Lynn, on top of your rib cage, like right here, to push your rib cage down? Because if you are doing that, then that is a crutch. And so ultimately we want to, if you're using any way that you're using the kettlebell, if it's being used as a crutch to help you, ultimately you're going to, that could be fine for now to help you accomplish the goal for now, but you're going to want to wean yourself off of needing that crutch to be able to accomplish the connection without it, because that's the way that you have to go through life. And so this program is training to go through the mundane activities of daily life and not to be training for the 1 hour in the gym. That's a different program, right? There's a lot of programs out there like that are gym training, but this is to be able to do stuff without the kettlebell. And so that is my advice. But in the beginning, using a crutch or an aid to accomplish the connection can be beneficial for just the neuromuscular training. Tim Kirby, I'm in week 6. My hip flexors are tight and I have popping right SI joint. I have been doing the bridges, etc. Do you recommend hip flexor strengthening as in banded marching? This is a very good question, Tim, because hip flexor strengthening is very important. And I think that it's just critical to have a solid core connection, aka to be able to protect and support your spine with your abdominals and the deep core, all of the abdominals, before you start hip flexor strengthening. Okay, because the hip flexor strengthening is by nature just going to be pulling on the lumbar spine. And so if you can't back that up with a strong connection, then you could be worsening your problem. But yeah, with that said, it is important to strengthen the hip flexors because, as I was saying earlier in the stream, one of the reasons muscles tighten up is because they don't feel safe or strong or have enough endurance to function in the lengthened range. So we can stretch our hip flexors all day long, but if we don't strengthen them in that new lengthened range, they're just going to tighten right back up. And so that's why it is really important, but I wouldn't do that without building the foundation of core connection and spinal protections or support with your abdominals beforehand, and then engaging that throughout any hip flexor strengthening exercise throughout and maintaining it as a top priority. Amber, Beverly, you're welcome. Amber, Elena Air. All right. I don't know if that's your name, but I'm the student now. I am in Germany, and when the emails come because of time lapse, I have no opportunity to write a comment. Is there any chance to do it? Program is so good. I think that's what you're saying. Hey, that's fantastic that we have somebody in Germany in the program. Thank you for being here. Thank you for sharing. Yeah, we're glad to have you. Welcome to Germany. Now, the question I'm not totally clear on because of the time lapse. You don't have opportunity to write a comment. The comments are done in the student hub, Elena. So you do have access to the student hub as a member of the program, and so that's where you would write your comments, and then they can be answered by other students or team members of core balance training, or answered on the stream. Especially we're going to be doing live streams in the future just for student hub members, and so I'll just be answering questions in there. And so, yeah, you can get your questions answered. You don't have to be anywhere at a specific time. You just post your question when you have it. So hopefully that makes sense. Yeah. So John Spencer just started Module 6, but I already started walking a lot more based on your live stream on that topic. And it was a big turning point, feeling so much better. Hey, that's awesome, John Spencer. Thank you for sharing that. I hope that inspires other people to do the same. It was a game changer. And don't think of it as an option or a homework or something that you're supposed to do. It's mandatory. It is not an option. Walking is your human locomotion design, and that is what you do as a human, and it's not an option. So thank you, John Spencer. Appreciate the share. Patrick Pellegrino, is there hope for people with herniated discs recovering? I can't find the sweet spot of doing PT without overworking and underworking. That is one of the hardest things to do, Patrick. And it's going to require patience. It's going to require listening to your body. And it's going to require reflecting back on all the past experiences, the recent past experiences that you've had, and going, all right, this was a time that I overdid it. So next time I do that, I am going to just go a little bit less and see what happens. And that is the magic, is just to go right below overworking. Because if you go way below overworking, you're doing the underworking, right? And you're not going to get really any benefit from that. Safe to, for everyone it's different, but some people have to really, really tune in to listening to their body, reflecting back. And that might be you. That might, Patrick, you might be one of the people that's just got to, like anyone with tendinitis really has to do that too, because tendinitis is an injury that gets worse from underworking it, and it gets worse from overworking it. So you got to look at it like that, and that's the game that you play. And you got to look and try to enjoy it. This is a challenge, and you got to work right below overworking to get the maximum benefit and progress your tolerance. But yeah, there's definitely hope, tons of hope, copious abundance amounts of hope for people with herniated discs. And maybe it's just the PT that you're doing. Maybe it's not how you're doing it, but it's what you're doing. There's two factors there. So it's really more important how you do things. And so I would, I'm not sure what kind of PT you're doing, Patrick, but I would consider taking a look at that and asking yourself, are these things helping me? And if not, what are the things that do help me? And if you don't have anything, then there are things out there that can help you. Even just do the free trial, and you'll see that there's a lot of people, including hopefully yourself, that you can just get benefit just from the free trial. And cancel the free trial when you're done, and your life will have been improved if that's the way you want to do. Let's see if I can. Oh gosh, I'm losing ground, so let's keep going. Amber, my question is, if the core is really tight when staying on the bridge, because you speak often about just intention. When you get into the bridge, you are beyond just intention. So we want to apply the intention that you are practicing it with back anchor and front anchors. But with a functional movement like the bridge, it's beyond intention. It's beyond the 10% rule. And you are keeping everything as tight as, you're keeping those abdominals as tight as you need to stay connected and prevent, anterior pelvic tilt. You want to win that tug of war. So yeah, tight, glutes tight, abdominals tight, and apply those same intentions that you practiced in the anchors. And describing get fat is the same as when I breathe into the lower back and close the chamber, the breath forward, the pressure increases inside, and you have the feeling getting fat too. I'm not fully sure what you mean on that, but I do think that it might be similar, because you said get fat is the same. So yeah, there's going to be tension with the breathing, because it requires tension in the abdominals to send the breath back. So you could do it high intensity, or you could do it low intensity, 1% all the way up to 100%. You can have max tension in the abdominals and send a real big deep breath into your lower back. You will feel the expansion in your lower back from doing that, and you can get benefit from that. It's just not sustainable to do that all day like that. So you want to learn how to do it at the 2% or the 1%, because that's how we are breathing normally. And this is training for the everyday mundane activities of life. Holy cow, I almost feel like I need to take a break, because I've been going just question for an hour and 15 minutes. And the mind gets tired. Let's see if I can catch up. So Jose Resquin, you were the last question that I see right now. I am going to stop answering questions in the chat after I answer Jose Resquin. So that is where I'm going to end it, just because I am running out of steam here. So hopefully people can hear me about that. And let's go back to Teresa. You are in phase 2 of the program. Since starting the program, your lower back pain went away. I'm finally feeling the deep abdominals. Fantastic to hear, Teresa. Thank you for sharing that. And I hope that inspires other people. Yeah, stay committed. I'm so happy to hear that. Breann Marie, Amber, I get fat when breathing into my lower back as well. Okay, so if that's the question that she was asking, yes, you get fat when you're breathing into your lower back. That means you're doing it right. That means you are involving all your core muscles, the deep ones and the superficial ones. That's what you really want to do. Ideally, you can get to the point where you can breathe where your six-pack abdominals are not really having to be that involved, and it's the deeper muscles that have the tension that can send your breath back. That would be the ideal situation. Sandeep, I'm having issues with right hip and lower back, possibly pelvic tilt. Will this program help me? Yes, I do believe that this program will help you, Sandeep. I believe that Many people experience improvements in hip pain from the changes that we make to our bodies in the program. And obviously the program is targeted towards lower back pain, and pelvic tilt is a huge part of that. So yes is the answer that I believe. Teresa, any tips on strengthening the serratus anterior muscle? I'm noticing mine is weak. So you're doing a push-up, Teresa. Okay. You can do this motion. I'm protracting and retracting my shoulders. Watch, I'll do it from this angle. It requires serratus anterior to do that motion, to protract the shoulders. Some people call it a push-up plus. And so once you get to the top of your push-up, you protract your shoulders forward. And that is the best way I know to strengthen the serratus anterior. Indy Curry, you're welcome. Lisa Bavona. All right. Yeah, great questions to everyone. That's a really good point, Lisa. Bob Hoffman, thank you so much for the support. I think they call that like a super chat. So thank you, Bob. Really appreciate it. Relationship. It's Kelly Van Diver. I'm in the program. I had to have emergency surgery last week. Couldn't even walk to the bathroom. I'm at home healing. Would like to know when you think I can restart core training. Was it back surgery, and was it minimally invasive? Because if it was minimally invasive, actually, Kelly, I think I saw your post in the Student Hub. You said a week and a half. So you were like into the program by a week and a half. So, maybe the surgery was necessary to be able to do the things that you need to do to get better. And I think this is a good way to look at it, as this is a new beginning. And hopefully it was a minimally invasive surgery. It sounds like it was. And just to snip out a piece of disc that might have been compressing a nerve. And that can be a turning point for people. So you got to ask your doctor, because you are under his care right now, your surgeon. So he makes the rules. But if it were me, now I'm not giving you this advice because it's up to your doctor. But if it were me, I would be doing the back anchor connection and push away. Back anchor, day 1, maybe day 3, back anchor progression. I'd be doing that already. I'd be doing that right now. And I would have been doing that on right after the surgery, as soon as I could, because all it is really meditation on sending electrical flow into those muscles that help you to connect to your core in a healthy way. So you can do it at a super low level and progress from there. Bob Hoffman again. All right, check it out, Bob. Thank you so much for the support. We do really appreciate it. Micro discectomy. Okay, there it is. Amber, you're very welcome. Asti, I believe Amber is talking about the comments under the lessons. Yeah, so Amber, the comments under the lessons don't actually open or close. They are frozen from over 2 years ago now. I can't even remember when we closed those, but nobody posts there anymore. Those are just frozen old comments, and you're not missing out on the ability to do that. So it's the Student Hub now. Relationship loft. After surgery, what is your recommendation on walking post-op, even if you have pain? Walk, even if you have pain. That's my recommendation. Walk 5 times a day, relationship loft. I'd say minimum 5 times a day, as far as you can go without making your pain worse. You cannot walk too much, especially right now, or ever, but it's more important to walk right now. I was feeling really good at making progress, and I have been overdoing it. I think so now I'm having to take it easy. Okay, listen to your body. It's one of the more common problems is that people have that hold them back from making progress is overdoing it. So continuing to have setbacks is a really big cause of stunted progress. It's a little bit of progress, setback, a little bit of progress, setback. And so if you can just the progressions need to be smaller and smaller chunks, and that can allow you to build on the little bits of progress that you make. So yeah, listen to your body. It's really common, and you're not alone in that. Jose, I had back problems last 6 months. Last 2 months, I was feeling pain-free. Going back to cycling, I was only feeling a little stiffness under my calf. Then I replaced a ceiling fan and the pain came back. Well, overhead activities where you're having to arch back and look up at the ceiling is really going to test your ability to protect and control the movement in your lower back, preventing overarching, overextending in your lower back, and trying to put some of that motion into your thoracic spine and getting more mobility there. So that's where I would say focusing on the thoracic mobility on the foam roll lesson, and then front anchor, upper front anchor, push away, and all of the progressions of that. And next time you got to do an overhead activity on the ceiling, thank you, Austin, I see your post, then having that motion come through the thoracic spine rather than the lumbar spine, because that's exactly the thing that can cause an exacerbation, is excessive backward bending, repetitive backward bending. Painting, electrical work are other things that can do that as well. Cycling is a no-no for back pain. I don't think it's a no-no. I think it's just not optimal, and it's not something I would do to get out of back pain. I don't think it's not the rehab I would do, but the goal would be to do the rehab so that you can get back to your love of cycling. And I think that's very possible. You do the rehab, you get out of pain, get your body back into balance so that you can do cycling because you love it. I don't recommend doing cycling because it's a good rehab for your body. It's not. So don't do it as exclusively for the purpose of doing rehab for your body. Do it. The reason you cycle is because it's a passion of yours, and I wouldn't not take that away from you. I think that that's very possible to do. Same thing with surfing. Surfing is not really good for your back. The popping up repetitively, it causes a lot of back pain, and a lot of professional surfers have back pain. So I have to do it because it's my love. So that's the way that you would want to approach things like cycling as well. But you do the work on your body so that you can, and that's the motivation. Yeah. Good question. Lynn Creech, no arms extended away from the chest. Is that from, I don't know what that is in reference to, Lynn. Was that the kettlebell, maybe? Kettlebell question? Either way, the answer is going to be the same. If you're using it as a crutch, then you want to kind of wean off of it. Bye, Dr. Breann, and thank you for a million. Oh, NPE, that makes me kind of sad. I'm a little bit sad. I will be back. You're very welcome. You're welcome equally as much. And we will be doing occasional, maybe once a month or every 2 month public live streams. So we'll notify everyone when that happens. And I'm super grateful for people like you that have shown up consistently, NPE. It's inspiring to me and other people as well. Same to Gilda, another familiar name showing up very frequently. Is walking hills bad for SI joint pain? I would say walking downhill is quite stressful if your SI joint is loose or really out of balance, like, uneven. So you got to walk downhill if you're going to walk uphill. I don't think walking uphill is really that bad, but yeah, if you can walk up a steep hill and down more of a low grade, that would be okay, or downstairs. But walking downhill itself, yeah, is a little bit tough on the joint. Tim Kirby, my pain is all on my right side. I'm left-handed dentist and twist to the right all day while working. I also had right side inguinal hernia surgery. How can I unwind to counteract my daily twisting? Man, that's tough because you're a dentist and you're not going to want to do your dentist work right-handed. So you got to find something else to do right-handed. And yeah, you got to counterbalance. Yeah, you use the word counteract. It's the same thing. You got to do it. You got to do it, and you got to get creative, because you can't usually I would say brush your teeth, with the other hand, but you can't brush somebody else's teeth with the other hand. So you got to find other ways to do it. And, it's all about balance, right? Yeah. Surgery was a year ago, but you have scar tissue that pulls you to the right. If you got scar tissue, you should get some hands-on with that, some tissue mobilization from either a really well-trained massage therapist or a PT, and you got to counterbalance the twisting with other things in your life. So I don't know if it's dishes, stuff that you do one-handed, you got to start doing with the other hand, and maybe you got to create a hobby that you do. I think that would be really beneficial, because you're going to find that with your dominant side, you do things that you don't even realize. So like holding the driving wheel, you're driving to work, you're going to do it with that dominant hand, that left hand. And so maybe just do it with the right hand and feel the shift in your abdominal muscles when that happens. It's like a full-blown shift in the muscles that engage and how they engage. Don McCreary, thank you. This is my first time here, and I helped by your insight and instruction. You are very welcome, Don. We're really glad to have you, and grateful for people like you that show up for yourselves and ask the questions that help other people as well. So thank you. All right, so I got the Student Hub Student of the Week, and this is normally something we do early on in the stream, but this stream was a little different, and so we are going to announce that, and then I'll be signing off on this. This is the last weekly public stream that I do. Maybe I'll be doing it monthly, but Breann Falta. So Breann is Student Hub Student of the Week. We're recognizing you, Breann, for asking the questions that you asked. Very thorough, comprehensive questions. And you also were very helpful to other students and just supporting others along in their journey. So thank you, Breann. We are grateful for your participation in the Student Hub and all the other students as well. We created that community for you with the goal in mind of exactly what you're doing. So thank you. We want to honor you by giving you an extra month to your membership. And so you have to do nothing. We'll add that to your membership from the back end. And we're grateful for you. So thank you so much, Breann. And thank you, everyone, for being here live, for asking great questions. I do believe Breann was here. I saw that name, so I don't know if she's still here. Oh, there she is. All right, Breann. Cool. So, yeah, recognizing you. And it even says more. It happens so often that the Student Hub Student of the Week is here live, and it says a lot about the type of student they are. So you're very welcome, and thank you. And thank you, everyone, for being here. It feels like a little bit of an ending to a season of life in core balance training, where I come on every week live to the public for everyone. But I will still be doing the same thing. It would just be exclusive to students in the program, and that's simply so I can help them more, so that I don't have to be short with my answers. I want to be able to give the best help possible to have more success stories. And so that me showing up is not changing. It's just where I'm showing up. I'm showing up in the Student Hub now, and we will have occasional, maybe monthly or every 2 months, public streams for people interested to ask me questions. So again, thank you all for being here, and really appreciate you. It's been fun, and we'll see you next week for those of you in the program. All right, take care, everyone. And until then, get down on the floor and connect to your core. All right, bye-bye.